third one is which approach gives the least incidence of avascular necrosis in congenital vertical talus, and there are four approaches given, which is extensile. Extensile is basically an extensile approach, which can be Cincinnati or an extensile lateral. It's not mentioned. A sinus tarsi approach, posteromedial approach. So I think I really had to find a lot of literature to see the answer to it. To be very frank, I was not 100% sure about it. Uh, but yes, there was this article. So basically, if we talk about congenital vertical talus, I think the dictum is right now is that you have to first of all give a period of classing so that you can actually do some correction of the deformity and let the soft tissue stretch out, and then after that you have to do a surgery which is relatively minimally invasive. So many a time people are doing dual incision, which is medial and sinus tarsi. Another option is a complete posterior approach, in which you're releasing the posterior structures, or they can be, an extensor like a Cincinnati kind of an approach, or a dorsal approach. So this is a paper which is basically based in 2001, which compared the posterior approach versus the dorsal approach in treatment of congenital vertical talus, and avian risk was 48% versus 0%. Dorsal approach, the advantage was it has lesser operative time, better clinical scores, and fewer complications at the 3-year follow-up. However, disadvantage was the inability to release the posterior structure, so you might have to consider doing for that if you are contemplating posterior structures are tight. So if you do a bit of stretching and posterior structure become loose, I think this is a good approach. Dorsal can be done in a longitudinal way or a transverse way, and both the cases, the risk of avascular necrosis is less. And you know that most of the blood supply actually comes from the posterior tibial or through the peroneal as well as anterior. And from dorsal, from distally, the supply is relatively less. So I think that might be one of the reasons. So the answer is dorsal in this case.